Okay, hello everyone. We got Dr. Mark here and Dr. Jason, and we're kicking off ChiroLive. We've never done this before. Dr. Jason, how you doing today?
I'm doing well. How are you?
Doing awesome. So the way this kind of got started, I've never done a podcast before. We've never had a show before for our office, but we get all these questions in the adjusting bay. We have all these different conversations, and then we get together as doctors and we're talking about patient situations and all these things that are happening. We say, man, I just wish this conversation could have been heard by all of our patients, because it would help them so much. We'd be able to answer these questions for them all at once. And so, we're going to do some frequently asked questions with the doctors of RFC and handle and tackle some of these questions that we get often. So today we're going to get into some things about mobility. We're going to talk about keeping your spine healthy. We're going to talk about how that relates to the nervous system. But just for starters, I mean, Dr. Jason, you're the newest doctor on board on the team. I think a lot of people would want to know just where are you from? Where are you actually from? Where do you come from? How'd you get into chiropractic? I know for me, I didn't have some majorly dramatic story of my life being saved by chiropractic, but I've grown into understanding how life-saving it can be. But what was your kind of story getting into the profession?
Sure. My family, my older sister had been going to a chiropractor since birth. She would go through these fits of colic and she would just scream and not sleep. I understand. So they would take her to the local chiropractor for what they called her attitude adjustments, and
Right.
she'd get adjusted, and she'd go home and sleep for 3 hours, and she'd be fine for 2-3 weeks. And they found that with regular maintenance on that type of schedule, she did much better, and her attitude was much better, and she slept through the night.
Yeah, absolutely. I love the attitude adjustment thing. That's that's something I think all of us chiropractors eventually talk like that. It just kind of comes around.
Right.
Yeah, and that's fantastic. And you're originally from the west side of Michigan, correct?
Right. I was born up north. I lived in Newaygo until the time I was 5 years old. Then moved to Jenison. I've been there ever since.
Okay, and you've been in practice for how long?
About 11 years.
Okay, awesome.
Mm-hmm.
Awesome. Yeah, so there's a lot of experience that Dr. Jason's bringing in. And then there's the experiences that I've had and what our other doctors have had. And the idea is we're going to collaborate all those different experiences into these ChiroLives to just give you the different perspectives on how to best take care of your spine. And I think when we talk about taking care of your spine, what I've noticed is that's the most infrequently asked question, even though we know full well that it's the most important thing to take care of. But rarely does somebody say, how do I keep my actual spine healthy? They'll say, how do I keep my hair healthy and looking shiny and nice? How do I keep my skin healthy? How do I keep my teeth looking really good and healthy? So why is it that people aren't asking, how do I keep my spine healthy?
Well, the teeth, although they're important, they're visible. There's a vanity thing going on there. I think that if our spine were on our face, we'd probably take better care of it. It's, just like our feet, we take it for granted. It does what it's supposed to do, hold us up. It's always there. You don't think about it. It's hidden. But it is important. It's one of the most important things to take care of in your body. It's where life flows through.
That's so true. I just gave a talk to a group at a senior center, and the topic of conversation, and I want to put this up because this was a slide that I used to for them, and it's this right here: motion is life. This concept of motion is life. If you have good motion in your body, motion in your spine, there is life that is flowing to your body through that spinal motion. And so when your spine gets rigid, when your body gets rigid, that's when things start to stagnate. That's when health starts to decline in all areas of the body. So motion in your blood flow, motion through the nerve impulses, motion in your muscles, motion in your joints. That's what keeps things alive. And so you look at this picture here, and the nervous system runs through your spine. And so for your spine to protect your nervous system, you have to be in this proper alignment. So you've got the 3 different curves from the side, like we're showing there. And what can happen when the spine gets rigid, this is what I want to talk about, is what people don't understand is that there's actual physiological processes happening within the joints and within the discs that can result in not just rigidity, but actual disease of the joints and discs. And so as we get into the phases of spinal degeneration here, can you just kind of walk us through a simple way of explaining what is it that happens from normal into phase 1, 2, and 3?
So normal, you can see we have this proper lordosis, which is that backwards flowing curve. There's the front and the back portion of the spine. The front is the vertebral body, and the back portion, those are called the facet joints. It's those more diagonal lines that you can see. When you have that proper curve, the weight distribution, so all the forces that come down from gravity and from the bouncing around of the head when you walk, when you run, with that proper curve, those two structures would be sharing the weight about 50-50, 50% on the disc, 50% on the facet joint. Now with the straight spine as indicated by phase 1, you can see that all those forces are being just driven right down through the disc, that front portion of that straightened spine. So that is effectively twice the load on the same area. So you're doubling the effect of gravity. And there's a little more that goes into it than that, but that's a simplistic explanation. So that's going to speed up the degeneration of those discs. As that situation progresses, if it's left unchecked, if you don't go to a chiropractor and get that corrected, it gets worse. So those discs start to degenerate. The ligaments that are holding that spine in that straight position, those starting to loosen up. And as those discs start to fall forward, the neck starts to collapse forward. So you're going to lose that, although it's incorrect, that straightened curve. It gets worse from there. So phase 2, you've got a bit of a forward flexion. You start to see that the discs are much thinner than in the normal or phase 1. And as they get thinner, the body sends out almost like little tendrils, and they start reaching towards the bones, almost like these feelers. And you can see you've got this sharpness coming out in the front of those bodies. And they start reaching towards one another so the body can stabilize it by eventually fusing them together. The body knows something is wrong, and it's doing the best that it can at that point to stabilize the situation. So it's creating a bigger surface area for that bone, so there's less abnormal movement. And as you move on to phase 3, you have less of a disc, and they're even closer to being fused. Beyond phase 3, you have complete fusion, and that's when it gets really hard to correct. As you progress from normal to phase 3, each stage gets a little more difficult to correct. That's why it's so important to get in early before you get to one of these phases, so that it doesn't take so much work and effort to get it corrected.
And I think that's the thing that's interesting is you're mentioning it progresses, and then as it goes from phase 1 to phase 2, it's going to get worse because the head is forward. So gravity is constant on the front of the spine. And
Yes.
if we remember back in school when we took embryology class, and you study how the bones develop in the spine, the back part of the spine is where the harder bone is. It's the more dense bone that's meant to bear weight, because a curvature like you see in the normal one that's the solid structure that's meant to bear the weight. So you're supposed to be bearing weight on the back of your spine, even based on how hard the bone is. The front of the spine has less dense bone. So then if you're bearing weight on the front of the spine, like in phase 1, it might look okay still in phase 1 with the discs and how the bones are structured. But if it is left there, it is a guarantee that you'll have disc degeneration and bone spurs, because you have to build more bone to support the weight of the head. And so I think this is what people don't quite understand, is that the spine, it will get worse. And even though it might be a slow progression, the studies show that if once the spine's out of alignment, this progression of degeneration in the discs goes at 7% each year when you do nothing about it. So if it's 7% every year, you might not feel any different from 1 month to 3 months later. But if it's progressing in that direction, your spine is actually becoming more and more rigid, which is why people will say, well, yeah, 5 years ago, I was doing this type of activity. Now I don't do that anymore. And really the pain just came up recently because until that degeneration is affecting the nerves, you might not feel any pain at all. That's why when we talk about subluxation and misalignments, subluxations can be present in the spine for upwards of 10 to 20 years before feeling the first symptom at all. So that's why it's so important to get these x-rays taken to know, okay, if the head is forward and you have a forward head posture, there's a guarantee based on physics that it's going to degenerate those discs and continue to go forward. And then you see, especially in women, that rounding in the upper back, that hump at the base of the neck there, that nobody likes. And a lot of people think that, oh, I have that because my mother had that, or my grandmother had that too. I guess it's genetic, but there's actually nothing genetic about that the granny hump. It's the fact that the head has gone forward and the spine has had to morph and adapt to the weight of the head being in that forward position. So that's where you enter into phase 2 and then eventually phase 3. And when you look at phase 3, now the discs are so thin that the bone is almost touching each other. Like you said, it's like, I love how you explain that, like the bones are reaching out to each other almost to stabilize the position, which means innately our bodies are creating stability by healing the spine in that solid position. Because the worst thing that can happen is your spinal cord being kinked. So your body's so smart that it will hold the spine in place and create rigidity around that just to keep the spinal cord safe. Problem with that is now you have a rigid spine and you really can't move well. And as soon as the head goes forward, it makes the rest of the spine rigid. So even in phase 1, people are starting to notice, well, I have upper back pain. Now I have headaches. Now I'm dealing with just a stiff neck and a stiff upper back. Sometimes people even say, well, my lower back has been hurting. And we look at their x-rays on their lower back and it looks totally fine. We look at the neck and it's a total mess and it's forward and straight. So when we can start to get the neck fixed, what can happen with the pain in the rest of their spine? It can get better. So yeah, I just think people don't understand that there's a progression that is happening here. There's slow but sure, things are deteriorating in the spine when you are bearing weight unevenly. Do you have anything to add to that?
No, I think you nailed it. I couldn't have said it better myself.
And you look at what is actually happening in the disc, and this is where I think like what I used to think discs were before I learned about this was that you have your bones and then you have rubber, kind of like how our spine models have like rubber or foam in between it. Like it's not actually living tissue. It's just rubber. It's like, well, there's no rubber in the human body. It's all living tissue. There's all cells that form up our bodies. And so everything serves a purpose, and everything in our body is living material. And so discs are not exempt from that. It is made up of living material. And it's not rubber. And so with improper movements and some things that Dr. Jason, if you can go over kind of like what causes this, you can see that how discs actually start to degenerate and then create what a lot of us know as a disc injury or like a disc herniation. So where do disc herniations really start?
Generally, it's improper movements, whether that be through just repetitive trauma, something you do at work, through sports. Often it's the silent killer subluxation left unchecked. With a subluxation, you've got a joint that is not bearing the weight, the forces equally. So you've got more pressure on one side. You could think about maybe a car that has the trunk loaded up with bricks, right? Definitely an uneven distribution of weight, of forces there. So naturally, the back tires are going to bulge because you've got all that weight back there. With a subluxation, you're going to have the spine shifted and fixated to one side or the other. And all the forces that go through that joint several thousand times per day are going to work to wear out those outer fibers of the disc. So the outer fibers of the disc, it's called the annulus fibrosus. The inner portion is called the nucleus pulposus. So those outer fibers, if you think of them as like the skin of an onion, several layers. It's very tough fibrous material. But when you have that unequal distribution of forces, what become the inside the smushy material called the nucleus pulposus, that becomes pressurized, and that's going to push out on one side of those fibers, that outer ring. Although they're very strong and they do have healing potential, you think about every time you move, you take a step, you shift, that each time that's putting more pressure on one area of that outer, those outer fibers. And little by little, they give way. They stretch, they stretch, they stretch until finally they start to give way. So you can have a bulge, or you could have a herniation. So herniation is when that inner material actually pushes through a crack or a fissure in those outer layers. A bulge is just the point where those layers have stretched enough to kind of bulge out. So because of that pressurized inner pulposus, when that happens, when either of those situations happens, you're looking at nerve compression. That's when things like sciatica or arm pain start occurring. And we all think about sciatica, the pain that goes down the back of the leg. What most of us don't realize is that that nerve that goes down the back of the leg also has a branch of nerves that you don't feel that goes to the organs of the pelvis. So you think about sciatic nerve, organs of elimination, reproductive organs, in addition to all the muscles that coordinate your step and your gait and give power to your legs.
Absolutely. And you think like, well, who's most at risk for a disc herniation? Because I think sometimes we'll think that, oh, it's the person that does manual labor and they're lifting and they're twisting and they're moving all the time. And I don't know about you in your years of experience, but what I've seen is that it's actually more so the people who are sitting a lot that are going to be at risk of a herniation in their disc, because when they're sitting, all that pressure is being put to the back of the spine for so many hours a day without movement. And so when you don't have movement into those discs, they become rigid, they start to become harder, and then it's a lot easier for that nucleus, which I've heard of it as like a toothpaste consistency. Like that's kind of what it would feel like if you were to feel it, starts to push out those annular fiber layers. And then you don't necessarily feel it though, right? I mean, there's not necessarily a disc bulge pain unless it becomes a disc herniation, or unless it pushes so far out to the outside that it's physically pressing on nerves. So that's why this is just yet another one of those things that builds slowly, but then happens suddenly. We talk about that in the office all the time. Disease processes, they build slowly, but then they happen suddenly. And we can be reactive and wait for the thing to happen and then go and seek out solutions, or we can be proactive and take care of our spine. So how do you, and looking at like a more detailed view of what a disc is made of, how do you go about keeping your discs healthy? What have you found to be the best ways to keep the disc healthy, keep these living tissues thriving, even in conditions where you're sitting or you're lifting a lot?
Sure. Well, as you said, sitting is the number one cause for a bulge or herniated disc. So getting up every so often, if you had a desk job, I tell people to drink a lot of water, because number one, you're hydrating yourself. And number two, you're forcing yourself to have to get up at least once every 45 minutes if you're drinking enough water. Mm-hmm. So staying hydrated is going to be great for the disc. Getting up, movement, keeping your weight in check, eating an anti-inflammatory diet. The inflammation can really do a number on the disc, really anywhere in your body. I think of inflammation as the good analogy as almost like an acid etching away at the structures of your body. So you want to eat an anti-inflammatory diet, chiropractic care to keep those forces equalized within the disc space by providing a more stable joint and a level joint. And just, of course, keeping your core strong and, being careful of abnormal movements. Generally, the movements that damage the most it's number one, flexion, and then flexion with a rotation involved is a surefire way to hurt yourself. So I would avoid those kind of movements.
So like in the snowy season in Michigan, and you go out at like 6 o'clock in the morning with your shovel, and it's that heavy, wet snow, and you go in there, you dig in, and then we're picking up this way and twisting and throwing the snow at the same time. No wonder we get so many disc herniations when it starts to snow and people get out there, or then early in spring when the landscaping starts and they're bending for it. If they haven't been doing that a lot, your discs are going to be at more risk of herniating. But as you can see in here, this is living tissue, guys. There's actual blood flow that's going into these discs. There is real anatomy about these discs, and keeping them healthy happens on a microscopic level. Your health happens at that cellular level. And if you can keep all your cells healthy in your body, then what are you? You have a healthy body. You are healthy if all your cells are healthy. So we really got to get down to, how do I keep my cells healthy? And in this situation with the discs, it's how do you keep the cells of the disc healthy? Well, motion and blood flow is the key, because the blood flow to the disc really only happens with proper mobility. And when it gets stuck and when it gets stagnant, that's when the disc becomes degenerated and it creates disc disease. So we don't want that, because that leads to much worse things. Like Dr. Jason mentioned, it starts to press on nerves. Those nerves don't just go down to your legs, they go to your digestion, reproductive organs, prostate, bladder, kidneys, from the lower back, and so forth. So to keep them healthy and to keep drawing blood flow into those discs, what we found is the best way is with those daily rehab exercises. So if you were to do your wobble exercise every day, twice a day, like it's usually prescribed, especially in the corrective work, for a month, you've just introduced so much more blood flow to this disc. Why is blood flow important? Well, it carries nutrients, it carries oxygen, it carries all the vital components to feed the disc so that it can stay hydrated and it can stay mobilized, and it stays in that softer consistency, which means you stay mobilized, you stay active. You see people get really rigid at certain ages. Let's call it 50 years old. The person who's 50 years old that has been taking care of their discs lives a much different life than a person who's 50 who has not been taking care of their discs. And that difference in quality of life can be so major, and all of it is preventable if you can just keep this one thing really, really healthy. And so, yeah, getting chiropractic adjustments, obviously, because we're moving the bones, we're moving the joints, we're taking pressure off of those discs by correcting the spine. But then on your part as patients, every day getting on that wobble disc. I don't know about you, Dr. Jason, but I found it best to put my wobble disc somewhere where I can see it in the morning so that I get on it. Anytime I'm going to work out, I make sure I do wobbles before that so I can get the disc warmed up, get it mobilized. Anytime we're doing adjustments for an entire afternoon, you and I are both on the wobble discs. We are moving our spines. We're getting our discs warmed up. Any other tips that you can give about keeping your discs healthy?
One thing that people don't realize is, the most common time to injure a disc is in the morning. So when we're at rest during the night, these discs, they don't have gravity pushing the fluid out of them. So they're actually pulling water in, pulling fluids in. So you're actually, and this effect is more dramatic when you're younger, but you're actually a little bit taller in the morning. And as you stand up and gravity pushes down on the spinal column, some of that fluid escapes to other portions of the body. So it's less pressurized. So for that reason, you have more pressure in the disc in the morning. That is the most likely time for someone to bulge or herniate a disc. So a lot of people get out of bed and say, oh, it's a great day, and they do their stretch and they bend down and touch their toes. I would avoid a lot of toe touching in the morning. Stretching your hamstrings, stretching is great, but I would wait till you're up and about for about an hour on your feet with gravity bearing down on your spine a bit. That's a rule I've always followed.
Yeah, that's really good. I can recall the few times that I've had disc injuries. I went to my weightlifting gym at like 5, thinking that okay, let's get after it. Let's go to town on these weights. You pick up the barbell, you do some deadlifts, and all of a sudden you realize, oh, that's not right. Something's not feeling right. And there's just too much pressure into the back of the disc. I probably could have used better form too. Maybe I need some lessons from you, Dr. Jason. But But with that said, I mean, lifting weights is healthy for you. You want to be building your muscle around your joints. Um, I don't know if you can speak to that, but I've noticed that as I've gotten more into weightlifting around my core and my legs, and actually targeting the lower back for stability, that
Yes.
there's been less pressure that I have felt on my discs after an entire day of adjusting, or if I have to sit down for a long time planning a seminar or something like that.
Mhm.
How can you speak to muscle building and stability?
Well, the core, you've got to have a strong core if you want to have a stable back. If you think about, I like analogies. If you think about one of those really tall, those radio towers, some of them are like 1,000 feet tall. Think of that as your spine, and then think of those wires, like those guide wires that tie into that. Think of that as the muscles that surround the spine, like your core, for example. So that tower in and of itself is not very strong. If something came along and hit it, it would probably break. And that's a very tall structure. What keeps it stable from outside forces like wind and things like that are those wires pulling from every direction, right? To keep it taut and stable. So that's the same concept, or you could apply that analogy to your spine. If you didn't have any muscles surrounding your spine, or they're weak, every time you get up, or let's say you stumble, all those forces are being transmitted through the bones and through the disc, and you're going to get a shearing force on those discs. And that's a lot of leverage there between your upper and your lower torso that can transmit through one relatively small area. So those muscles will help to take the brunt of any external forces. The force, by and large, will be transmitted through the muscle before it actually gets to the joints. The muscle will minimize the forces going through the joint.
It's really good, and I think what I've noticed in a lot of patients is that as they get stronger, as they start really focusing on building muscle and getting stronger, instead of just working out to lose weight, let's say, but let's focus on building muscle. Their muscles have been calmer too. So as if muscles are weak, they tend to get tighter because they're not strong enough to be stable. So they tighten up, and then with tight muscles comes more pain and more soreness and less stability around the disc. Whereas as if you take the concept of I'm going to wrap my joints with strong muscle, then you're just like you said, you're taking pressure off of the disc. You're not bearing so much weight on the discs and the joints. You're bearing weight kind of throughout this whole fascial, the fascia and the muscles and all the connective tissue is bearing your weight for you, so that it doesn't land on this thing that you see on the screen here. Because when that disc starts bearing weight, which it's not supposed to necessarily be for bearing weight, it's meant for movement and being able to move your spine and twist and turn and play soccer and bend down and do the things that you like to do. It's not meant to bear weight. As soon as it's bearing weight because of misalignment and rigidity and weak muscles, now you're going to deal with disc degeneration. And I think the other thing to consider is that when we are rigid, when our spine is rigid, it affects the nervous system in a way that it creates stress throughout your nervous system. You think about what is the posture of a stressed out person, and everyone would recognize the stressed out person as someone that is kind of like this. They're rigid, their neck is forward like this. They're not very relaxed in their overall posture. So you look at this chart here, and I love this picture because it's like just a cartoon and everything, but it really gives a good picture of what's going on. You've got these two sides to your nervous system. We talk about this all the time, but this is a good way to think about your neurology. You have your stressed out side. This is your stress response. It's called sympathetic. So some of the things that happen, your pupils expand, you have shallow breathing and very fast breathing. You're stressed out. Your heart rate is high. Your gut is not active. Why is that? It's like you're in an emergency threat mode situation, like you're trying to run away from a bear that's chasing you in the woods, which isn't a good idea. They'll catch you. But if you are running away from a bear, what's going to happen to your digestion? It's going to shut down because all that energy needs to go to your muscles in your legs so you can run away or so you can fight the bear. and your pupils are going to expand, and you're going to take in more oxygen. Your heart rate's going to go up, so because it's preparing you for survival. The problem is when you're stuck in a survival mode in that sympathetic state on that left side there, then your organs and your overall bodily function starts to just slowly shut down over time, and that leads to dysfunction, which ends up leading to dis-ease, which becomes a disease. And so we want to get out of dis-ease and into a place of ease. And you look on the right side, that's when your parasympathetics turn on. So if the stress side, sympathetic side is your gas pedal, the parasympathetic side is like your brake pedal. And so that's when you're able to take slower, deeper breaths to oxygenate your body. Your heart rate is down. Your body's working efficiently. Your gut is working well. You're absorbing nutrients well. Your hormones are signaling properly. You're able to calm down your mind. Your reproductive organs are working like they're supposed to. You're able to sleep deeply and have dreams and wake up refreshed. That's when your parasympathetics are doing well. In a stressed out posture, in a rigid spine, you tend towards the sympathetic side. And chiropractic adjustments, along with keeping your spine healthy with rehab, have been shown through the research to create a parasympathetic response in your body. Anything you want to add to that chart or the cartoon picture here?
No, but that, this ties into the fact that adjustments specifically to the upper neck have been known to decrease blood pressure, the top number, the systolic, by up to 14 points. And that's thought to come from the effect that happens from the adjustment, bringing us from a sympathetic state more into a parasympathetic state. So, yeah,
absolutely. I think this is the thing that this is the effect beneath the effect. Like this is that cause for, when you look at someone saying, "Oh, I started getting adjusted. I thought it was just for my back pain, but my digestion got better," or "I started getting adjusted and now I'm sleeping better," or "Now I'm producing energy better," or "Now I feel like my body's detoxing again." It's not that, it's not that we pushed the detox button when we adjusted you, or we adjusted the L3 vertebra, which turned on your digestion. It's not really like that. It's more so that as you get the spine healthy and as you create more mobility in the spine and take pressure off of the nervous system altogether and move tip that scale from stress response over to parasympathetic response, then the digestion is going to work like it's supposed to. Then yes, your brain is going to be able to connect better with your heart rate and with your breathing patterns and with your stomach and your kidneys and your liver, and just your body's functioning is going to be increased, but really more so it's going to be normalized, because a normal functioning body should do all those things well. And I think just to close this out here, it's like our bodies were designed to go between the stress state and the calm state as needed. And I think just way too many patients that we see come in, they're stuck in that stress sympathetic state. And we look at their spine and we take the x-ray, and of course they are. Their spine is rigid, it's out of alignment, their head is forward, it's creating neurological interference, but it's also just creating so much rigidity that if motion is life, then rigidity is really leading towards death. And I think a stressed, sympathetic, locked state of being, it's like you're functioning at a lower level, and a lot of people just don't realize it. And I think if we can get the word out too, I mean, as you all as patients are learning this, educate the people around you, tell them about this. You can see when somebody has the gas pedal on in their nervous system and their brake pedal is broken. And if their brake pedal is broken, then they're a candidate for chiropractic care, and they should be going to see a chiropractor. And whether that's us or somebody else, this is what I have found to be the quickest way to flip that switch and to tip that scale of the balance over to the parasympathetic side. Anything else, Dr. Jason?
No, you could think of the analogy as, when you make this shift from the sympathetic to the parasympathetic. If we're stuck in the sympathetic state and there was no bear chasing us, there's really no need to be in that state. So when you're stuck in that state, you're taking all of your body's resources and you're driving towards something negative, towards an unhealthy state. So when you make the switch from the sympathetic to the parasympathetic, you're taking that energy, which is taking you in the negative direction, and now you're heading in somewhere better. So it's like, you were heading in reverse before, you put it in drive and you're heading to your destination.
Absolutely. And you think about that destination, it's different for everybody. It's like, what do you want to be able to do with your life? What do you want to be able to do physically 5 years, 10 years, 15 years from now? Keeping your spine healthy is just such a key component of that. So that's all. We're going to cut it right here. Thanks so much, Dr. Jason. Appreciate you. This has been fun. Hopefully it was you guys enjoyed this as much as we enjoyed making it, and we'll be back for another one. Have a great day.